Okay, so with this disclosing agent that I just put on your teeth, it stains the plaque, also known as biofilm, on your teeth either a pink or a purple color. So the pink is biofilm that's been on your teeth for 24 hours or less, and the purple is biofilm that's been on your teeth for 2 or more days. That's why it's really important for us to do what we can at home to maintain control over the biofilm, because the longer that bacteria sits on your teeth, it can seep underneath your gum line and cause gingivitis, which is inflammation of the gums. And then the longer it goes without the disruption from, brushing, flossing, things like that, it can then turn into periodontitis, which is a gum disease that causes the destruction of the bone that holds our teeth in place and the ligaments. And so that's not something that you can, reverse. Like, you can't get that bone back. So that's why it's really important for us to take care of the supporting structures that we have, so we're not at risk for losing our teeth. Okay, so now I'm gonna ask you a few questions about what you do at home to take care of your teeth. So how many times a day are you brushing your teeth?
I'd say probably about one time, if I remember to.
If you remember?
Yeah.
Okay. And then do you use a manual or an electric toothbrush?
A manual.
A manual?
Mm-hmm.
Okay. So I'm gonna suggest for you to try to start brushing twice a day. So once in the morning, once at night. And then a manual toothbrush is fine. Just make sure that you're not brushing super aggressively, and use your toothbrush in like a back and forth motion, and make sure that whenever you're brushing, you aim the bristles up towards your gum line on the top or down towards the gum line on the bottom to help remove that plaque from the gum line. Okay. And then, are you using anything to clean in between your teeth?
Like floss?
Yeah, floss or a water pick.
No.
Okay, so your teeth are close together, like there's not wide spaces in between your teeth. So I think what would work best for you would be using regular string floss or a floss pick. Or if you'd be interested, you could use a water pick, and it also disrupts the bacteria from in between your teeth. But with that, it's kind of technique sensitive, so if you're interested in that, I would suggest watching yourself do it in the mirror, and then you just go around your gum line. But so like once you get used to doing that and get the technique down, you don't have to watch yourself do it. Like some people like doing it in the shower because it can be kind of messy.
Mm-hmm.
But I would suggest either using a water pick or string floss or floss pick at least once a day. But if you'd rather, you can start out just picking a few days a week, maybe like 3 days out of the week until you build that habit, and then you can add more days on. But that will help with your sensitivity, and the more you do it, the less your gums are gonna bleed. So I just feel like that would really benefit you to try to do that. And then, are you using a mouth rinse?
Yes. I typically like to mix it with some water though, because I don't like the burning feeling it gives me in my mouth. So.
Yeah. Do you know if your mouth rinse has alcohol in it?
I think so, yeah.
Okay, so maybe just try to switch to one that doesn't have alcohol in it. And alcohol also tends to dry out the tissues in your mouth. So instead of putting water in the alcohol rinse to kind of reduce that burning sensation, I would just say to switch to a mouth rinse that doesn't have alcohol in it.
Okay.
And then just do that each time after you brush. And then, like, whenever you choose to floss, do it after you floss. Okay. And then I also noticed during the extra-oral examination that you have a white spot on the side of your tongue.
Mm-hmm.
How long has that been there?
I started to notice it about a week ago.
A week ago?
Yeah.
Okay, is it causing you any pain?
No.
No? Okay. So I think what we're gonna do is I'm gonna get my intraoral camera and I'm gonna take some images of it and save it to our computer just so we can keep up with it. Like each time you come in, like we can look and see if the lesion has progressed or if it's gone away, just so we have documentation of it.
Mm-hmm.
But I can also refer you to another clinic and they can take a biopsy of it just to make sure it's nothing to be concerned about.
Okay.
All right, do you have any other questions?
I don't think so.
Okay, perfect.